I request our next presenter, Dr. Nimmi Rastogi, CEO of Sarthak Medical Care and team coordinator, AAMC, and member of uh, AAMC and member Rogi Kalyan Samiti, and media spokesperson of Aam Aadmi Party to make a presentation on landscape change in primary health, Aam Aadmi Mohalla Clinic, Delhi. I request you have 10
Yeah.
minutes, Nimmi.
Thank you. Thank you. A very warm welcome to everybody who is logged in, and my compliments for Indian Disability Forum and Indian Forum for Assistive for Rehabilitation and Assistive Technology. It's a great honor to be addressing, though it's not my subject. But I would like to add value to this webinar by telling you a story about a small idea that transformed into major changes in community health in general. Right. So I'm Nimmi Rastogi. I'm a practicing gynecologist in New Delhi, and I also work with the current regime in Delhi, the government, that's Aam Aadmi Party. So I'll tell you the difference between that idea struck and afterwards. So this is a story about Mohalla Clinic. So Mohalla Clinic, for those who don't understand Hindi, it's like common man's neighborhood clinic. So let's start with the presentation. Actually, Mohalla Clinic is nothing but a small clinic that is that the facility of which are available to people in the neighborhood without any fee or any cost for consultation, for test, for medicines, etc. So that has made primary health very, very effectively delivered in Delhi under this idea. So just a minute. Yeah. So to understand Mohalla Clinic, we have to understand the complicated dynamics of Delhi. Delhi is a highly populated city. It's both a city, it's a state, it's also a seat of power. So Delhi is complicated. Its official population is approximately 20 millions, but unofficial is 26 million, because scores of people come from adjoining states. So it shares its border with 5 states. So people come from those states to work and also come for their health needs to our facilities. So male-female ratio of Delhi is not that good, 866 females per 1,000 males, 9.2 elderly population measuring up to 20 lakh above 60, 30% of the elderlies are living on an income below 10,000 rupees. Rough estimation of people with disability is 2%. LGBTQ identification is approximately 2.6%, and there are multiple stakeholders. There is a central government, there is a state government, there is a municipal government, and they are under different political organizations. So there is a constant rift into delivery of any new health policy or plan. So before Aam Aadmi Party came into power, that's in 2015, before that, government hospitals were overflowing with patients. Primary health centers were non-functional, not effective. Dispensaries were there, but they were inadequate. And factory was flourishing. Private health was very, very expensive. And there was huge dissatisfaction at the level of patients. So what was happening is, even for the primary needs, people were going to tertiary care hospital. For instance, I live in South Delhi, so somebody with fever or cough will go to Safdarjung Hospital, which is not meant for this kind of job. It is meant for serious illnesses, admission, trauma, etc., etc. But there was huge rush in in tertiary hospitals and also secondary hospitals. And hospitals the care for the critical was also suffering. And one person used to stand in queues for hours together and losing his day's wages just to get medicine for common ailment for the lack of primary health center. So before we came into power, an organization called Dialogue and Development Commission was established with the sole purpose of understanding as to what problems Delhi has, what can be offered to people if we come into power. So it had 13 chapters, out of which health and education was took the major chunk, and I was part of that health task force. And then we called people from all professions. I mean, basically health profession, but pharma, nursing, even RWAs, common man, like what is the problem? How we can improve the health delivery in Delhi? And after consultation with at least 500 people and representatives, we realized that Delhi does not have effective neighborhood clinics, and something that can easily be done. So a pilot was launched in 2016 January, and Mohalla Clinic was born. So Mohalla Clinic is nothing but a small 2 to 3 room prefabricated Kota cabin. It occupies a space of 650 to 800 square feet. One MBBS doctor who's registered with State Medical Council is there. Two health assistants, one pharmacist, one multipurpose nursing assistant, and one phlebotomist in the field to collect blood samples and carry the reports. So, patient's registration is done on a iPad, and the data is stored on cloud. It is free for everybody, not just for people in Delhi, even people from overseas. If they have any small issue with their health, they can walk into a Mohalla clinic. 212 lab tests are free. Consultation is free. A list of essential drug medicine, 110 medicine is available. Though currently, recently, Government of India has expanded that list to 300 medicines. So all that is in the EDL is available in Mohalla Clinic dispensary. It's a 8 a.m. to 2 p.m. clinic. It works for 6 days a week. Clinic hours are expandable. If doctor wants and the rush is still there, they can keep on seeing the patients and shut it whenever they want. It's an air-conditioned clinic. And you'll be surprised to know that single doctor clinic manages something between 80 to 200 patients every day. And these are patients with common ailments like cough, cold, allergy, worm infestation, all kinds of minor things for which an MBBS doctor is enough. Other than that, there is a whole lot of awareness programs are going on, because now we have realized that since patients are coming to us, let us make them aware about communicable diseases, tuberculosis, hypertension, non-communicable diseases, and hygiene. All that is also explained to the doctor by the patients by the doctor. And elderlies, it's very popular with the elderlies, with the women, and with children. In fact, men go for work, therefore, it's
You have a
mostly
couple of
women,
minutes.
elderly, they come to us. And we also have evening OP in some Mohalla clinics. And then Mohalla clinics are also established in schools. We've also tried to establish them in defunct shipping containers. A doctor actually earns quite a decent money, because it's per patient. Doctors are not employed with us. They are just on contract basis. They earn 40 rupees per patient, and the minimum guarantee is 75 patients, whether or not such OPDs has that kind of patients. But on an average, every doctor ends up seeing 125 to 150 patients a day, which is a very big number. And that's how even the pharmacists and nursing assistants are receiving money based on per patients. It is free for everyone, as I told you. Some high-end diagnostic tests can also be requisitioned from Mohalla clinics. As I mentioned, 212 lab tests. You mention a test and it's available. HbA1c is available. Lipid levels are available. MH, which is such an expensive test, that's available. I mean, we collect the sample and send it to the lab, central lab, and those labs are on our panel, and we pay the labs CGHS rate, but we don't charge a penny from the patients. So we also plan to apply some technology, as in these are mobility friendly clinics. We also want to establish menstrual pad vending machines, water ATMs, incinerator, and whole lot of plans are there. Right now, 519 Mohalla clinics are functional, though our plan was to establish 1,000 Mohalla clinics, but there were certain challenges. 165 Mohalla clinics were recently inaugurated. There are 265 Mohalla clinics in schools. So these clinics are for health checkup of not just students, their parents, and teachers and the staff. So that increases the number of patients covered by Mohalla clinic. And lady doctors also posted in
Okay,
areas
Nimmi, you
where.
should wrap up.
Okay, all right. So it's been internationally acclaimed Mohalla clinic, and because people realize that such a small idea, if nicely implemented, um, can lead to improvement in primary health in such a way. Government spends as much as money as it used to. Now, the impact on primary health is so much that rush on tertiary hospitals has gone down. Worsening of primary health is decreased, and then now we want to integrate rehabilitation and immunization into Mohalla clinic, and we want to have community participation by way of Swasthya Mitra. So all these are everybody's gains actually. Even in the metro stations, they're establishing Mohalla clinic. So the moot point is that you don't have to look for some very high-end solution for some very basic problems. Some biggest of problems can be solved by simplest of solutions, and Mohalla Clinic is one such solution. Thank you.